Good morning and welcome to the Spectator Health Summit. I'm Alastair Stewart and I will be your host and interviewing and interrogating on your behalf as well a remarkable lineup of people. And we're here right through until just about 20 past 12, 12:30 perhaps this morning. Very, very good of you to join us all. Shaken by 9 months of pandemic with its tragic deaths and toll on the health of many, including lockdown, the tier system, economic catastrophe, we may now be on the brink of a vaccine-led recovery. On the economy, there are more second opinions than I care to even imagine, but we're going to focus this morning essentially on the health dimension, on the care issues, and also on the life sciences and what they've been able to do in this pandemic. We're going to have a quick look at how well structured and how well funded the NHS was during that COVID-19 pandemic phase one, how it's doing now, and what needs to be in place for the future. With social care, the elephant in the room after a decade of prevarication and procrastination, can we, should we, must we act now to build a viable, affordable, and effective new model? And what might it look like? And after the heroic efforts of the UK's universities, big pharma and manufacturers ranging from high-tech to PPE, what role can science and research play in the future development of other vaccines? Oxford on Friday coming up with malaria, but there's a lot more yet to be done. On therapies, on new effective bits of kit. And what role can AI, artificial intelligence, play in all of that? Can we capitalize upon the growth in the reputation of the United Kingdom in these fields? Or are we stuck where we are, as always, suffering from a slight disbelief in our own selves? I hope not. We've got 3 strong panels. We've got lots of times to take your questions. Just pop them in there and we will deal with them. And we also have a terrific keynote speaker. I'd like to thank our sponsors, MSD, this morning for making the event possible. And all of the panels this morning will be available to watch on replay on Spectator TV website and up on our YouTube channel. And you can ask a question to any of our panelists by writing in that text box at the bottom of your screen or by emailing events@spectator.co.uk. Right, off and running. And I'm delighted to say that the keynote address does indeed come from Nadhim Zahawi. Nadhim was in the business department and was transferred by the Prime Minister to become Officer Commanding the entire vaccine operation and ahead of a very, very busy day on the eve of what could be a monumental and historic day tomorrow. I'm delighted to say that Nadhim has found time to talk to us this morning. And Nadhim, I'm going to invite you to make that keynote address, and then I'm going to come back to you with a couple of questions after that. But first and foremost, over to you, sir.
Thank you very much, Alastair, and thank you very much for that introduction. This is my first speaking engagement since I took on the additional responsibilities as Minister for COVID vaccine deployment. And it is a fitting occasion to do so and talk about some of the advances that we are making in the battle against the virus. As one of the oldest weekly magazines in the world, The Spectator has borne witness to so many threats to public health since it was first published, I think in 1828. It has seen numerous outbreaks of cholera and typhus and the so-called Spanish flu, which claimed the lives of millions. And during this coronavirus pandemic, I feel grateful that we are able to call upon something previous generations could not, the power of digital technologies. Last year, my new colleague, the Secretary of State for Health and Social Care, Matt Hancock, came here and talked about the power of technology to make human lives better. And this pandemic has been a perfect example of what technology can really do. It's hard to imagine this arduous year without the technology that has been keeping businesses running, helping families to remain connected, and of course, allowing our democratic institutions to perform their vital role. And it is these advances that have helped our health and care system to stay strong, even in the greatest public health emergency in a generation. Really allowing everything from consultations to keep going over video, linking up, many hundreds of GPs, surgeries with their patients, millions of people to check their symptoms online, keeping them out of hospitals, and of course, our NHS COVID-19 app for contact tracing, which this year was the second most downloaded free app for iPhones, beaten only by Zoom, Alastair. A relentless focus on technology has proved to be so important during this pandemic, and we have made the investment so we could use it to its full potential. And even once we are through the worst of this pandemic, we will keep working hard to drive the adoption of biotech, genomics, AI, and all the emerging technologies that we know can make such a huge difference to people's lives. But this is not the only area where we are seeing exceptional growth. The global search for a vaccine has really seen phenomenal steps forward. We have always known that the best long-term solution would be a safe and effective vaccine. After clean water, vaccines are the most effective public health intervention ever devised by humanity. They are how we eradicated smallpox and how we're on the brink of eliminating polio. And each winter, they help our NHS to stand firm against, obviously, the flu. So in this battle against coronavirus, we've been working really hard to amass a huge portfolio of different vaccine candidates. And we have now amassed one of the biggest portfolios per capita in the world. Last week's news that the MHRA, and I paid real tribute to June Rain, who I've worked very closely with as part of the vaccines task force, had authorized the Pfizer-BioNTech vaccine, really was exceptional news for the nation. This means that we have been able to give it the green light after rigorous clinical trials and through absolute scrutiny from one of the world's most respected medical regulators. I think this is a real victory, not just for the UK, but for humanity and for all those who believe in the power of science. But we are not done yet. There are still other vaccine candidates which are in development, including, of course, the Oxford University AstraZeneca vaccine. And we still face the monumental task of deploying, as Alastair introduced me, the vaccine that are proved, that are go through the approval, but probably one of the greatest logistical operations that we have faced as a country. I'm really humbled and proud to have been asked by the Prime Minister to oversee this historic rollout in my role. And from what I have seen so far, I'm confident that we are in good shape. The NHS has been gearing up for this task for months, and the first people will be getting their jabs tomorrow. Tomorrow is going to be, I hope, V-Day, and will be remembered as that. As we do this, we will obviously prioritize those who need it most, including the elderly and our brilliant health and care staff. We owe so much to the pioneers and innovators who have given us this incredible hope of a better life beyond the pandemic. Rolling out a vaccine takes time, and so we cannot return to normal life overnight, but it is I think a pretty major blow to the virus, showing us all a path where we can carefully lift restrictions over the coming weeks and months. And I'm so proud of the advances that we have made. Today's event is a really important one, looking at our shared experiences of our fight against this virus and how we can make sure we are best equipped for this winter and, of course, beyond. And I hope our shared success in developing a vaccine can provide optimism and encouragement that we are making really significant strides in our effort to defeat this virus, and that we can defeat this threat to humanity by really calling upon the ingenuity possessed by humanity itself. So I hope that you enjoyed today's event, and I'm really looking forward to working with you all as I take on this, what I think is an exciting but nevertheless monumental task of delivering the vaccinations for our nation.
Nadhim, thank you very much indeed, and thank you for your kind comments about the Spectator magazine and its noble history there at the very beginning. And good of you to find time for us on a really busy day. Are you being too optimistic, though? There have been slight hiccups at the Pfizer end of it in the manufacturing. There's even been speculation because of the Brexit talks that the Royal Air Force may have to put Hercules and other transporters on standby to bring the stuff over. A, are you being slightly too optimistic? I can understand why. And B, can you tell us definitively when you think all of those vulnerable folk will have had not the first, but also the second jab?
Thank you, Alastair. You're quite right to sort of test the robustness of the system. Of course, in any manufacturing process, and not least with a new vaccine, there's going to be some challenges around the manufacturing process. But we've been working very closely with Pfizer and with the other vaccine candidates that hopefully, if the MHRA approves, we can deploy as well. I think I want to take it slowly. I've deliberately, said to the team, look, we've got to get this week right, and then understand, where are the bottlenecks, where is the sort of the stress testing of the system. This is a massive undertaking, initially through hospital hubs and vaccination centers, and then obviously through GPs, making sure we get all that right, including how we are going to be able to deploy a vaccine that needs to be stored at minus 70 degrees into our care homes, working very closely with the care home sector. But you're right, it's a balance between supply on the one hand, and then of course, making sure the supply chains are robust, and then demand on the other side. The bulk of the vaccination will be next year. We've got obviously the 800,000 shots that have come through from Pfizer BioNTech. There is now a very, very robust delivery chain in place. We will be able to do, as the Prime Minister said, hopefully a couple of million before the end of the year, and then the bulk of the deployment is next year. And we'll work through the categories as the Joint Committee for Vaccination and Immunisation have set out.
Nadhim, is there actually a grid that says care homes by February, over 70s by March? Because you rightly say, we hope to have most of it done by next year, but next year includes December as much as it includes January and July. Is there a grid?
So this is, the biggest challenge is the supply side. So are we working with a single vaccine? Are we going to get a second vaccine or even a third? Obviously, we've got Moderna as well. That's now been proved to be effective. That is my great challenge, is how do I balance the supply that's coming through, and then making sure that I go through the categories and essentially deliver as per the Joint Committee on Vaccination and Immunisation do. So what I can't tell you now is exactly what dates, and I think that would be completely foolish and unwise for any vaccines deployment manager to do.
Okay, let me butt in, Nadhim, only because of time. And you're clear on that. And obviously, even if there is a grid, there will be fluidity, because if Oxford does go through and ticks all the boxes, then you'll have more to play with doing a different job, ditto Moderna and so on. So hear what you say, ambitious target, but open mind and flexibility. Let me seek clarity on a second point. You talked about the possibility of immunity passports. When I've had all of my jabs and the Rolling Stones relaunch their concerts, I can go in and my son can go and watch Southampton Football Club, etc., etc. Other ministers pushed back on that. The Prime Minister himself said, we're not that kind of country. Can you this morning rule in or rule out the notion of an immunity passport?
There will not be an immunity passport. I think, I may have misspoken, or it was conflated in the interview I gave. I was talking about the brilliant use of the app, and then around people being tested, that we're looking at on the 15th of this month for people coming into the UK to get a test after 5 days. And if it's negative, then they can come out of quarantine. But as far as vaccinations, we're not looking at an immunity passport at all. The absolute focus is to make sure we vaccinate the 9 categories that the Joint Committee has stipulated, because actually the most important thing ultimately is to vaccinate the people who are at highest risk of death from this virus. And if we can do that, the sooner we do that, the sooner we can get back to normal life.
All right. 2 final questions. One, you talked in your keynote address about the power of technology, and you gave Track and Trace, the app, as an example of it. You're a former business minister, as well as now working with Matt Hancock on the health side and the vaccine side. Has this government learnt the key lesson of not doing deals with mates in delivery of important bits of kit who may not have the best track record, and not always, Nadhim, going to the NHS and their boffins to come up with ideas? Has the government learned that you need to go to the very best people, whomsoever they are, to get crucial jobs done?
Look, great question. So I was deeply engaged and involved in the ventilator challenge, where we brought together, it was a call to arms by the Prime Minister to bring the best of British engineering and ingenuity and innovation together. And we did that. We had everybody from Airbus to Ford to a small company called Penlon in Oxfordshire come together and deliver that. I think, if you're referring to the acquisition of PPE, where we bought something like 30 billion pieces or whatever it was of PPE. Remember, March was a time when the whole world was trying to source PPE. The United Kingdom could only produce 1% of its PPE needs then. All the contracts go through a rigorous process. They will all be published in time. People will be able to see them on gov.uk. And so, yes, of course, we'll learn from our mistakes. If that's your question, of course, we'll learn from our mistakes. But all I'm saying is we need to put it in perspective. Today, December 2020, the UK can produce 70%, 70 of its PPE needs versus 1% in March.
Final question, and a quick one. We will be having a panel later on about the role of the UK life sciences base, which government has committed to over the years, and you've been directly involved in it. Do you believe that the commitment is in its early nascent stages, or has what Oxford University with AstraZeneca done together in collaboration indicate a brand new model for UK life sciences, government, university, and capitalism, if you like, functioning in sweet harmony?
Alastair, so I co-chair the Office for Life Science, and what Sir John Bell has done is remarkable. It's been many, many years of working together. We're on our 3rd iteration of what we call a sector deal, where we work with the sector to be really ambitious of what we can do in the UK. It is no surprise that we've had Oxford and other incredible scientists working on the vaccine in the United Kingdom. There is real opportunity on clinical trials, which we're working because we have this extraordinary ability with an integrated system that is called the NHS to be able to do the most efficient trials in the world. And that has been demonstrated. We've got one of the best regulators in the world in MHRA, and that's proven now its worth during this pandemic, which obviously large pharmaceutical companies look at and think, wow, that's incredible. We really should be, when they're making investment decisions on these things. And of course, there are opportunities around diagnostics, so testing, vaccine manufacturing. We're brilliant at the catapults that we've set up and the cell and gene therapy, I want us to get as good as we are in the R, the research bit, as we are in the D. If we're really good in the development, i.e., growing these this innovation out of our universities into real businesses, then we would have made a huge difference.
What a fascinating point to end on, Nadhim Zahawi. The R we're very good at, D we're getting better at, but there's an M as well, manufacturing. Let's make sure we can do an awful lot of that here in the UK as well. I know you're a busy man, particularly now, and on behalf of all of us, good luck tomorrow, and thank you for finding time for us this morning. Nadhim Zahawi there, the Minister for Vaccines, talking about the power of technology, talking about having learned lessons on expenditure and cooperation with the private sector and on employment, and reminding us to remember that there are other vaccine candidates still coming through, and there is a grid for delivery, but it is fluid. Nadhim, thank you very much indeed.